And we have our next presenter, who is engineer Klára Doláková from Czech Republic. She's a candidate in applied ethics at Charles University in Prague, currently doing qualitative research on complementary and integrative healthcare in the United Kingdom. Her presentation is Integrated Complementary Alternative Medicine within National Healthcare, Professionals' Experiences and Views of Complementary and Alternative Medicine, Integration within the NHS in the Context of Ethics. Please welcome.
Dobré ráno, já ještě než začnu vlastní prezentaci, tak bych chtěla moc poděkovat.
Good morning. Before I start my own presentation, I would like to express my thanks to Mr. Tomáš Pfeiffer, the director of Institute for TCIM.
My PhD research project that I've been working on under the supervision of Dr. Aneta Jedličková at Charles University in Prague. However, past year I've spent at the University of West London and the Royal London Hospital for Integrated Medicine, where I've been completing my qualitative study focusing on the possibilities of integrating CAM within national healthcare in the context of ethics. So let me just make a very brief introduction. So in my research project, I'm using the term, the acronym CAM, that is used in most English-speaking countries. However, over the past few days, we've heard many different terms, for instance, traditional medicine, that reflects the global heritage of these approaches. We've heard a wonderful presentation of Nora Laubstein on that. And Nora also mentioned the term integrated medicine, which reflects a current phenomenon that's been going on for a while, and that is the integration of these approaches within national healthcare system, mostly based on significant public demand. And so when I started my research project, I found out a certain polarity in Czech scientific literature. On one hand, sources claimed that there is no possible collaboration between these two fields as they differ so much. On the other hand, other sources claimed that we should be looking for a pluralistic, sustainable future healthcare system. What professionals agreed on in the literature is the necessity to somehow reflect this phenomenon of CAM. The question is how? And that led to my research question. But before we get there, as I come from the field of applied ethics, I would like to emphasize the role of healthcare ethics, especially in the decision-making process in the healthcare. So let me quote Dunn and Hope. Medical practice should be continually improving through subjecting itself to the scrutiny of those twin disciplines, science and philosophy. Science asks what is the evidence that this indicated course of care and treatment, and philosophy asks what are the reasons for the moral choices made. Now, these two disciplines might use different tools, but combined together, they must be used to make appropriate decisions in healthcare. So let me give you a simple example of how we use some of the philosophy tools. Another quote of Professor Hecht. While there is no denying the positive results of these approaches in appropriate cases, and especially in a certain proportion of the population, they are usually ineffective and moreover carry serious risks and may endanger the health and life of the patient. So in this case, this statement actually implies and the professor is talking about CAM approaches, that all of them are usually ineffective and carry serious risks. Now, in terms of argumentation, this unfortunately represents an argumentation fault called faulty generalization. And why am I giving you this particular example? Because the publication of this professor led to the subsequent statement of the Czech Medical Society of Jan Evangelista Purkyně, which is dated to 2015, however, still available on their website, and that is that CAM presents a major ethical problem. Probably the only sensible way out is for the physician to be dismissive or very reticent about CAM. We could be talking about ethical analysis of these statements as well. However, I'm time limited, so if there's enough time left, we can look at it back at the end of my presentation. Now it's time to get back to my research question, which is very basic. So what are the circumstances, ethical circumstances, in which we can consider the integration of CAM approaches into healthcare? And because this is not what's been happening in my country, I had to search for a different field. So that's why I did my qualitative study in the UK to make sure that I explore professionals' experiences and views of CAM integration within the National Healthcare Service in the context of ethics. Very shortly, so I did basically 21 semi-structured interviews with professionals based in the UK, based on predefined topic guide, and I analyzed my data using framework analysis. And to the main point, what are the preliminary findings in the data? So I identified my research participants as doctors, but only those who have been actively integrating one of CAM approaches, CAM practitioners, but here I'm talking about those practitioners working in the first market. Again, thank you, Nora, for this terminology. And this might mean that I might have to interrupt my presentation.
Thank you so much. Thank you, We would like to continue with our presentation. Thank you.
So again, good morning, ladies and gentlemen. Hopefully I'll be able to entertain you still. So back to my presentation regarding the topic of CAM integration within national healthcare systems. So what were the preliminary findings in the data? As I mentioned, my research participants were identified in 3 groups as medical doctors integrating CAM approaches in their practices, CAM practitioners, but those working within healthcare facilities, and researchers and academics. In my coding scheme, I identified 3 main topics and key subtopics. So the first main topic was healthcare, defining what is conventional medicine, what is CAM, the CAM used in the UK, financing of healthcare, and issues in the healthcare. The second key topic was comparing conventional medicine and CAM in terms of regulation, safety, research, and education. And the third main topic was the integration itself, facilitators and obstacles of the integration, and key stakeholders that play a role in such a process, and possible future vision of CAM integration. And it seems to be the case that CAM is usually defined by what it is not. Now, this appears in the literature as well, and the problem with it is that it brings a certain negative connotation. For instance, in the Czech Republic, we often hear the term alternative medicine, implying that it's something outside the conventional Western medicine. Also, it seems to be the case that it's easier to integrate CAM through healthcare professionals, not just medical doctors, but also physiotherapists, occupational therapists, nurses, and so on, rather than integrating a CAM practitioner within the healthcare, although even that option is possible in the UK. So let me briefly mention key facilitators and obstacles in CAM integration. So what are the facilitators? Definitely there has to be openness and willingness to collaboration on both sides and that important dialogue. Also, what helps a lot is appropriate professional organization, professional bodies, setting up a regulation and safety standards, ideally codes of practice. And of course, we need proof of not just clinical, but also cost effectiveness. And now this could be an interesting point for the future research to focus on more on economical studies as CAM practices might be actually cost effective. Now, what are the obstacles of CAM integration? Insufficient research, which is very connected to research funding and its lack. Then there are some procedural differences affecting research. By that, I mean a point that Dr. Bhashwati mentioned here earlier, and that's the problem that evidence-based medicine paradigm concentrates mostly on drugs and medical equipment, rather than non-pharmacological approaches. However, even this obstacle could be overcome. Then there is an education gap. CAM is not usually taught at universities, so the knowledge doesn't get disseminated to other healthcare professionals. And the last point I want to make is a possible prejudice towards the field of CAM. And I'm going to illustrate that on another practical example. And that is the demonstrated case that despite the fact that some of the CAM approaches were integrated within the national healthcare system in the UK, after a change of guidelines or personal changes of health commissioners, who are the key stakeholders in the UK, CAM was removed again, or in this case, acupuncture for lower back pain. But there are still approaches that are being actively integrated in the UK. But to actually end on a more positive note, I would like to say that originally I'm a physiotherapist. And you know, in the 1950s, physiotherapy was considered to be alternative medicine. Now, physiotherapy is fully embedded within the national healthcare system. Also, as a physiotherapist, I noticed that many times I was providing patients with approaches that I can't define as evidence-based medicine. Why was that? That was mostly because those approaches were experience-based and they were embedded within the healthcare system due to historical tradition. What is the main thought that I would like you to bring home? That maybe it's time to redefine what are the criteria we're looking for when integrating a certain approach within the healthcare system. Because that way, it doesn't matter how we call the approach. Thank you very much.
Thank you very much, Engineer Doláková, for your presentation and your research, helping us look at complementary alternative medicine from the economical and ethical aspect.